Black boys, and look at whatever solution we can find.
Everyone, I'm sorry, let me just pause. So I wanted to make you all aware, we will record this because usually we don't, but this particular topic is so important. We really need to get it out to our Black community because, like I said in a prior preparation conversation with Dr. Johnson, I didn't even, really understand the magnitude or extent of what a problem this was for our babies in our community. So just want to let you all know that. With that being said, I'm going to go over to Justin Jennings.
Always have to remember to unmute myself. My name is Justin Jennings. I'm the CEO for Youngstown City Schools. I'm looking forward to the conversation. We have a lot of things we're dealing with in our community with mental health that we're dealing with in our school district. So I'm looking forward to a rich conversation.
Thank you, Mr. Jennings. Dr. Gary, you're up next, sir. Maybe. Going once, going twice. Okay, we're going to transition. Mr. James Fletcher.
Good afternoon, everyone. My name is James Fletcher. I teach 7th grade English language arts in Oak Park, Michigan, which is kind of not even a metro area of Detroit, Michigan. But I've been in education for 22 years now. Just looking forward to the conversation today about, again, mental health, as the other gentleman said. And so please excuse me. Also, I'm going to have the video off. I'm going to have to drop my son off to work right now. But Mr. Fisher, thanks for inviting me to this as well. Thank you.
Absolutely, Brother Fletcher. Absolutely. Thank you for coming.
I get off at 8 today.
Okay, we're going to transition over. Mr. Phillips, Ronnie Phillips.
Yeah, good afternoon, everyone. My name is Ronnie Phillips. I'm a veteran in this field, I guess you could say. I'm an educational consultant. I've been dealing with education a long time, but mental health has always been a problem in our community, and I'm really interested to hear some information how we can help some of these young people live a better life.
Hey, thank you.
Thank you.
Hey, I'm here now, Mr. Fisher. Sorry about that.
Not a problem.
Good morning, gentlemen.
Yeah, Dr. Gary, go ahead. No problem.
Good morning, gentlemen. Thank you, Mr. Fisher, for inviting me. Robert Gary Jr., Principal, Madison Middle School. Been with Seattle Public Schools 30 years. I'm always trying to grow and learn. So thank you, Mr. Fisher, for inviting me. And good morning or good afternoon to all the people on the call.
Absolutely. Thank you, Dr. Gary. I appreciate it. Moving on, Mr. Sullivan Shaw. If you will unmic, sir.
Yeah, Sullivan Shaw. Thank you for inviting me. I'm an assistant principal here at Interagency Academy, Alternative High School in Seattle. This is my 3rd year in Seattle, and I want to thank this queen for coming and sharing her knowledge with us this Saturday. So thank you. We appreciate you.
Absolutely, we do. Thank you, Brother Shaw. Brother Steve Elam, unmute and introduce yourself, sir.
All right. Hey, I want to say my name is Steve Elam. I'm a student support specialist, education consultant. I'm excited to be on the call. Definitely interested in helping come up with some strategies to help implement. I work in Southwest Detroit. ACEs is one of the things that I've been working with the adults with. So I want to help focus on helping our young Black boys, brown and Black boys, because they're all going through it. And that was one of the questions I had, but I'll wait. Excited to be on the call.
All right, perfect. Let me think for a moment. I don't believe I missed anyone, but if I did, I apologize, and go ahead and unmute yourself and introduce. Okay, perfect. All right, so now let's go ahead and introduce our speaker of the hour. This is a personal friend of mine, going back almost 30 years now. Wow. Okay. She hasn't changed maybe 0.5%, but I've changed quite a bit, but she still, when I reached out, she still came. So I appreciate it. So let me go ahead and read this introduction. Danielle Johnson, MP, FAPA, earned her medical degree from Drexel University College of Medicine in Philadelphia, PA. She completed a psychiatric residency and was chief resident at the University of Cincinnati College of Medicine. and the University Hospital. Dr. Johnson is board certified by the American Board of Psychiatry and Neurology. She treats adults in the inpatient and outpatient settings and has expertise in treating women's mental health issues. She is a board member of the International Society of Reproductive Psychiatry. Dr. Johnson is an assistant clinical professor in the University of Cincinnati College of Medicine, Department of Psychiatry and Behavioral Neuroscience, providing education to medical students and physicians in training. She has spent her career at the Lindner Center of Hope, which is part of the UC Health System in Mason, Ohio. There, she helped develop the Women's Mental Health Program. She served in various leadership positions and was promoted to Chief Medical Officer in August 2019. Dr. Johnson is an active member of the Ohio Psychiatric Physicians Association, serving as chair of the Ethics Committee and a fellow of the American Psychiatric Association. Dr. Johnson was selected by her peers as one of Cincinnati Magazine's top doctors in 2019 and 2020. She was awarded the 2020 Excellence in Mental Health Care Exemplary Psychiatrist Award by NAMI Southwest Ohio. She is a reviewer for mental health content on UpToDate.com and Women'sHealth.gov. Dr. Johnson is co-author of the book, The Chronicles of Women in White Coats, and has written articles for online blogs such as KevinMD.com and Doximity.com. She has been interviewed for national publications, including The Atlantic and Bustle. Dr. Johnson has presented locally and nationally about mental health. She is particularly passionate about topics relating to women and minorities and underserved communities. So with that being said, everyone, please unmute and let's go ahead and welcome Dr. Johnson.
Thank you. So Thank you again, Mr. Fisher, for inviting me today. As he said, we go back to college. We've known each other for a long time. And can you all hear me okay?
Yes.
Okay. So thank you for having me this afternoon. It's very fitting also that we're talking about this topic because today is World Mental Health Day. So it's a very fitting conversation that we're going to have today. And I'm glad that you all are here and interested in learning about how you can help the children in your schools and hopefully get information about the children in your lives as well, because this is a very pressing issue. The rate of suicide in Black children has increased tremendously, and it's something that we all need to be aware of, and you all are in a great position to help with this issue. So we're going to watch a video and then we'll talk about it further. Thank you.
Yeah. Thank you, Sister Danny. So everyone, just to kind of do a little bit of pre-learning, we're going to watch a short video on the scenarios which are facing our community, our young Black children, with regards to suicide. After the video, Dr. Johnson will lead us in a informational conversation, and then we'll talk about solutions, and then we'll open it up for questions, and then we'll conclude. So that being said, I'll go ahead and get ready to present. Brother Justin Jennings, can you see the video?
Yeah, yes, I can see it.
Okay, perfect. Thank you.
Black children under the age of 13 are twice as likely to die by suicide than white children.
It felt like people were looking down on him. So we buried him this high, so when they had to come and see him, they always had to look up.
And experts aren't entirely sure why this deadly disparity is happening.
Mental health does play a big part. We need more support and awareness. We got to break the cycle.
Over the past decade, suicide attempts among Black children rose 92%. On January 19th of 2019, 10-year-old Seven Bridges was one of those children.
Seven was a blessing to everybody that met him. From the day he was born, he was always the star and didn't know it.
Tammy Charles is Seven's mother. She alleges that physical abuse and racist slurs at school harmed her son's mental state. So throughout 2019, she used Facebook to document her son's struggles.
I'm in the school and my son has been called a and children.
Despite their visits to the school, Tammy and her husband Donnie claim Seven's bullying continued. They believe the bullying prompted Seven's suicide after Tammy found her son dead in his bedroom.
I started CPR on my baby. I did the proper compressions. I breathed into his mouth, and I had been drinking coffee. And as I began the compressions again, I could smell the coffee come back out of his lungs. I knew then that my son was dead.
As Tammy sat at the hospital, dealing with the aftermath of Seven's death, she wanted only one thing.
I just want to see him again. Before you take him, before you do an autopsy, before you embalm him, let me see my baby.
A 2019 study found that children who died by suicide were more likely to be Black and male. 2 years after her 11-year-old son's death, Nataya Chambers is still searching for answers.
I dealt with mental health, and I seen the signs in my son, and I didn't even know. When my son passed away and hung himself, I just couldn't believe it. And I think, how do they think of this and how do they do it?
Your voice is changing, yes, talk!
Rylan was my best friend. He was an honor roll student. He was a basketball player. He was a tutor for his school. He was just a good all-around perfect kid.
A 2019 study found that suicidal ideation, which is when someone thinks about or plans a suicide attempt, decreased between 1991 and 2017 for children of all races. But when researchers took a closer look and surveyed children, they found that suicide attempts for Black kids rose 73%. Experts suspect many factors, including a relative lack of mental health care access. In some cases, there may be a link with abuse and trauma. But the list goes on. After all, there is no single cause for suicide. Dr. Michael Lindsay is the leader of the Emergency Task Force on Black Youth Suicide and Mental Health.
From a policy perspective, we are doing what it takes to get mental health professionals in every school, not just one professional, but proportionate to the number of kids in a school.
The Congressional Black Caucus originally tapped Dr. Lindsay to head the task force in 2019 in an effort to combat the growing number of suicides among Black youth.
We need education campaigns. We need those who have been impacted by the issue, celebrities or athletes, entertainers, to speak openly about their struggles and how they got connected to care.
We miss you, buddy. Everybody misses you.
Losing their sons is one of the hardest things that will ever happen to Tammy and Nataya. What makes it harder still is that no one knows exactly why this is happening to so many Black children like Seven and Rylan. In the meantime, both mothers are trying to define what it means to heal.
I got his name on me. I want to get his face, but I miss my son so much.
For Tammy and Nataya, a part of their healing was creating organizations that spread awareness and support parents who've lost their children to suicide.
I don't even know how I'm still here telling my story, but I know this is my job. This is what I gotta do. If I can spare any parent grieving or any child, just one, that would make me so happy. That's what I really want to do.
People like me, the survivors, the families and friends, that suicide has touched our life, and what do we do? How do we move forward? There's no right or wrong answer, and there's no path to it, but at least we can talk about it together. We lend our voice, we lend our hearts, we lend our hugs.
Okay, everyone, that was powerful. I'm gonna go ahead and give everyone just a few moments to, dry your eyes if you need to. Just take a few moments, go ahead and process that, about 30 seconds. And while we're doing that, Dr. Johnson and I are prepared to transition into introducing the problem of practice. So go ahead, take another 15 seconds and just think about what we just saw. Okay, are you ready, Dr. Johnson?
Yes.
Okay, so what we're going to do now is we'll transition to introducing the problem of practice, and I will let Dr. Johnson talk about suicides, ACEs, and other traumas experienced by our Black children. Go ahead, take it away, Dr. Johnson.
Thank you. Well, as we saw, that was a very powerful video. It's very impactful to see how that impacts the people left behind. As I mentioned earlier, today is World Mental Health Day, so this is a very fitting time to have this conversation. Just to give some background, in the United States, 1 in 5 people has a mental illness in a given year. And it's put it in more perspective since we're talking about youth. 50% of mental illnesses present by the age of 14. So a lot of our children are dealing with a mental illness. And more specifically regarding suicide, just the prevalence of that problem is that there's 132 suicides per day in the United States. Typically, suicide has been thought of as a white people's problem, just to put it very bluntly. People did not think of it being as a problem in the Black community. Still, the majority of people who die by suicide are middle-aged white men. About 70% of suicides are still white men. But the reason we're having this conversation is that the CDC did a study about suicide rates between the years of, and I have to, just to make sure I get these numbers right, I am looking at my papers here, between 2007 and 2017. And so they found that for Black youth, the rate went up from 2.55 per 100,000 in 2007 to 4.82 per 100,000 in 2017. So close to doubling of the rate. Still much lower than white children and other races. So overall, for adolescents, between 2000 and 2007, the rate held steady at about 6.8 per 100,000. But then in 2017, they saw this large jump to 10.6 per 100,000 for youth of all races or ethnicities. And just keep in mind in general that suicide is still a big problem for youth, even though it's still older white men who are the largest rate of completed suicide deaths. That for youth, particularly between the ages of 10 and 19, it's the second leading cause of death. So that's behind any injury or any type of medical illness. And it's right ahead of homicide. So suicide is still a big public health issue for youth. And then what else they noticed, particularly for Black youth, is that for Black males, this was a very scary statistic. Well, first, Black youth in general, under age 13, were twice as likely to die by suicide. And then when they drew it out by gender, Black males as young as age 5, so between ages 5 and 11, were twice as likely to die by suicide than their white peers. So babies as young as 5 were killing themselves. And then the suicide rate in Black youth has been increasing faster than any other racial or ethnic group. And again, this is something that had never been seen before in all the years that they have been compiling this data. And so that's why they started the task group. They mentioned the Congressional Black Caucus had a emergency task force now because this was just so alarming that Representative Watson Coleman is the head of that task group because just so alarming that Congress got involved. So they're compiling some data and have a lot of experts trying to figure out how to solve this problem. And some of the reasons that they found that this might be happening, well, we'll get to that in a minute. Some of the other data that they found. So the CDC did something called the Youth Risk Behavior Survey. And again, I want to make sure I get these stats right. So I'm sorry, I'm looking at these papers. So between 1991 and 2017, and they mentioned this in the video, suicide attempts rose by 73% in Black adolescents, so in boys and girls. But for Black boys, injuries by their attempts rose by 122%. So Black boys were doing things when they attempted suicide that were more lethal. Usually when girls attempt suicide, they might do something like take pills, but boys will do things that are more dangerous, firearms, hanging, things like that. So they're doing things that cause injury that might actually lead to you going to the emergency room or hospital. And then another thing that's important that they noticed, so in a self-report, they noticed that in Black youth, suicidal thoughts or suicidal ideation, like they mentioned, those thoughts had actually decreased, but suicide attempts had increased. So what they were noticing is that Black youth were going straight to just trying to kill themselves. They weren't even thinking about it first. So they were having more kind of just jumping straight to it instead of planning it out. So that was of significant concern. And then as he mentioned in the video, that one of the biggest reasons for this is that there is a lack of treatment. Black youth are less likely to get care for depression, which is a major risk factor for suicide. And we all know several reasons for this. Healthcare disparities is one of the biggest ones. So uninsured, underinsured, a lack of mental health providers that look like us. So a lot of people feel uncomfortable seeing someone who doesn't look like them when it comes to mental health. The stigma of getting mental health treatment. A lot of people in our community feeling that they should rely on church first, which is absolutely nothing wrong with that, but there's nothing wrong with going to church and seeing a therapist or a psychiatrist, or feeling that it needs to be a secret. So there are just a lot of reasons for that. And then also, I think too, and we can talk about this in more detail, not really recognizing what depression is. A lot of parents and even the kids themselves don't really know that it's depression. They just know that something's different, but can't really identify that it's depression. So now that the statistics are out of the way, some risk factors that you need to be aware of to identify in your students, and also that you can educate parents too. So risk factors for suicide, as I mentioned, having a psychiatric disorder. So most common mental illnesses are anxiety disorders and depression. Gender, as I mentioned, females are more likely to attempt suicide, but males will actually die from suicide. So have to be very on high alert with our boys more so than our girls. Being in the LGBTQ plus community, so not only are you being discriminated against because you're a minority, a racial minority, but then being a minority in your racial group, because a lot of times in our community, that is not accepted. So you're kind of a double minority. So there's the stress of that. A history of having any prior suicide attempts or suicide behavior is a risk factor. So any kid who's done it before is at higher risk of doing it again. Being a victim of bullying or even being a bully yourself is a risk factor. Socioeconomic factor. So of course we know kids, and that's just an issue, low socioeconomic status. And as I mentioned, because they're less likely to have access to care is part of the reason. Impaired family functioning, poor family support. exposure to suicide, so any family history of suicide, knowing a family member or friend who completed suicide, classmate. There's a lot of schools who have had clusters of suicides, or even a well-known celebrity who has completed suicide. And having access to lethal means, this is very important. As I mentioned the firearm issue earlier, in general, 51% of suicides deaths are by firearms. So it's very important to know about firearms in the home, encourage them to be locked away, as well as ropes, cords, excess pills, knives, if there is a suicidal child in the home. Adolescence and screen time is an issue. Most adolescents have phones, are on TVs, but those who engage in social media have actually been found to have higher depressive symptoms and suicidal thoughts. And a lot of times it's due to comparing themselves to other people. Or a lot of, not only that, there are some challenges on social media that are related to suicide. Most recently on TikTok, there's like this Benadryl overdose challenge, which is ridiculous, but kids do these things. Delinquent behavior, so kids who tend to get in fights more, steal, set fires, vandalize, things of that nature. Kids who use substances. This is a very important one, and I think one that was not an issue as much when we were younger. The same with the social media. We didn't have that issue either. So, and exposure to online racial traumatic events, and this was a study done last year. So Black and brown kids who saw videos of things happening to their race. So for Black kids, it was police shootings. And for brown kids, it was, brown kids of immigrant status seeing, all the videos of like ICE detentions and, kids being pulled away from their parents in the detention centers. They found that those kids who saw those videos online or on the news ended up having symptoms of depression and PTSD. So, when we were younger, I think probably the worst that we saw, not that it wasn't bad, but the worst that we saw was the Rodney King video. And that was kind of a one-time thing in a few years, whereas now, just since the pandemic started, it's been Ahmaud Arbery and Breonna Taylor and George Floyd, and several other videos that kids have had to see. And then as well as still dealing with detention centers and finding out that, kids are still being separated from their parents, and people in detention centers are getting COVID and they're getting forced hysterectomies and all those kinds of things. So our Black and brown kids are dealing with a lot of trauma in addition to COVID. Not only was the suicide and depression rate already high for our kids, but now they're with the pandemic and all of the racial unrest, us as adults are dealing with it, but I think it's even harder on our kids. And then, of course, which is kind of a no-brainer, trauma and ACEs at adverse childhood events. So first, adverse childhood events. I'm sure you're all aware of anytime experiencing violence, abuse or neglect, witnessing violence in the home or community, having a family member attempt or die by suicide, growing up in a household where there's substance misuse or mental health problems, or instability due to parents being separated, or a household member being in jail or prison. So those are all considered adverse childhood events. And those are considered happening between the ages of 0 and 17. And what we need to be aware of about ACEs is that they're linked to chronic health problems, they're linked to mental illness, they're linked to substance misuse through childhood all the way up to adulthood. So I treat mostly adults. The younger people I treat are mostly kind of the transition from high school to college age. But the majority of the adults I treat, I'm seeing them because they have ACEs. If they didn't have something happen in their childhood, they probably wouldn't be seeing me now. So, and also people with ACEs end up having negative impacts on their education and their job opportunities. Women and racial and ethnic minorities are at greater risk of having 4 or more ACEs. So that leaves our kids in that higher group. There's an increased risk of having injuries, sexually transmitted infections, problems between maternal and child relations and their physical and mental health, teen pregnancies, involvement in sex trafficking, and then increased risk of cancer, diabetes, heart disease, and then what we're talking about today, suicide. And then other things that we mentioned to touch on a bit, things that Black and brown kids are more exposed to than white kids: racism, discrimination, violence in their neighborhood, economic insecurity. Something that affects our youth as well is how our people are portrayed in the media. So when they see all these negative images, that leaves them low self-esteem and feelings of hopelessness. These trauma, go ahead.
Thank you, Dr. Johnson. So I want to inject, I want to pause right there. Nationally, a lot of districts, or just nationally, the trend in education is we're doing more work around racial equity. And it's interesting that you brought up that piece. And I just want to, lift this up and draw everyone's attention very close to this particular point. We've talked about all the impacts of the lack of equity and the inherent racism, even the racial contracts that Brother Charles Sims, I believe, talked about. But that's the one thing we hadn't thought about. We always think of the people my age, Danny's age, and the rest of you. We kind of come from, our parents were that first generation that came up from the South, and they transferred their resiliency to us. Like we were, we all could take it. We could hack it. And so that's part of the reason that we're guilty of the hardiness that our parents transferred to us. Is kind of creating blind spots with regards to our kids, because our kids that are now like 14 to 20, maybe 23, we didn't transfer our resiliency over to them because we didn't have the direct experience that our parents had in Jim Crow. But just something to think about, everyone. Those racial experiences that we're talking about, we're reading these books about, none of them are really talking about the direct connection of racism and the trauma from that to suicide. So that's something that, when we're thinking about how we're going to address racism in schools, let's add that to our consideration of possible outcomes. Well, not even possible outcomes, the data is showing that it's a real outcome, and those are permanent outcomes. Like that's probably one of we can address and maybe correct some of the other outcomes of our children dealing with racism, but we can't correct suicide, right? I guess that's permanent.
Right.
So I just wanted to pause right there and just lift up that intersectionality between what Dr. Johnson is talking about and what we do as educators. Hey, Danny, I'm sorry to interrupt you. Go ahead.
No problem. And yeah, I'm looking at the time, so I'll try to wrap it up soon.
Okay.
So, and then also Black youth who have a history of trauma like physical abuse, 5 times more likely to attempt suicide than adolescents without a trauma history. And then, as I mentioned again, ACEs, especially having multiple ACEs, increasing the likelihood of suicidal behaviors in adulthood. So kind of now that we know all these negative statistics and risk factors, what are some protective factors that we can think about? What protects a child from attempting suicide? So having strong family support and relationships, religious and spiritual engagement. And like I mentioned, that is great to have. It just doesn't want to be the only thing that you rely on. If someone has a mental illness, they still need treatment, even though they have strong spiritual support. Community and social support, and then personal factors like having positive self-esteem, emotional well-being, strong academic performance, and then things that you just lead to good quality of life, stable housing, income, and employment. Those are things that really everybody wants and needs, but unfortunately we don't all have, but those are things that reduce suicide risk. And things to think about regarding how Black youth present if they have a mental illness. So particularly with depression, since that's so common. So a lot of Black youth express their depression symptoms differently than white youth. It can look like irritability, anger, behavior, and conduct problems. Very important for you to be aware of in education, because of course that's going to lead to going to the principal's office, suspension, expulsion. So we want to recognize if they have these problems, do they need behavioral health intervention before they end up getting conduct intervention? That's how we break the school to prison pipeline, because most of the people in prison have an untreated mental health issue, or most of the Black people in prison have an untreated mental health issue that if they would have gotten treatment probably wouldn't be in prison. So, but that's a whole other conversation.
I think just a middle note, and I'll put it in the chat. I know Brother Shaw, if he's still on here, he's probably gonna want to follow up on that as well, because that's some of the population that he works with as well. So that,
okay.
Yeah, thank you.
And then also when Black youth are dealing with mental health issues, they are more likely to be referred to inpatient services, whereas white children are more likely to be referred to outpatient services. So Black children, not just youth, but adults too. So Black people more likely to get inpatient services, more likely to be put on more and stronger medications, more likely to be misdiagnosed. So those are just some things to be aware of. And I'm sure you are all aware of Black kids are more likely to be disciplined more harshly, as we talked about school to prison pipeline. So as educators, you need to be aware of potential, behavioral and conduct symptoms. Could this child be dealing with depression? Could they be dealing with anxiety? Do they need help? Referring for treatment, advocate for students whose parents might be hesitant to get them help due to fear or stigma. Like I said, a lot of times parents aren't aware. There's a lot of stigma in our community. Sometimes parents are fearful that they'll get referred to CPS. So that's something we have to deal with as well. And, still being the advocate that the Black students in your school are not getting more harshly disciplined than the white students in your school for similar behaviors. So I will stop there because I know time is short. So.
Well, thank you very much, Dr. Johnson. I appreciate it. That was great information, and we needed every bit of it. And I like how you specifically tailored it to our babies, because we need to. And anybody knows me knows that I'm Pan-African, I'm a Garveyite, and so I'm just going to speak honestly. We need to unapologetically, give me a second. I want to make sure everybody sees my face, so let me bring this camera. We need to unapologetically advocate for our children because no one else is. We see, just as Dr. Johnson highlighted, everything gets worse when you're Black. If there's increased suicides for members of the LGBTQ community, well, if you're Black, it goes up even more. I just saw a study that showed with white women, there's an income pay gap with white men. Every white woman makes 78% or 78 cents on the dollar for every white male. Well, Black women actually make 38% less money than white women per dollar. And the crazy part is, as the education levels go up, the income gap gets even bigger for Black women compared to white women. So everything gets worse in America when you're Black. So I like the fact that you tailored it to that specific area. One more thing before I forget, everyone, make sure that you go ahead and drop your information in the chat so we can follow up with you if we need to. With that being said, let's go ahead and transition, Dr. Johnson. I think you kind of talked about some of the things that we could do to protect ourselves, but this is kind of going to be a Q&A part as well. We're at the part of the agenda, and everyone, the agenda is it's an attachment if you look as well. What's the solution? So at this point, I want to open it up for some questions, because I want these particular monthly meetings are action oriented. It's great to have the robust academic conversations and discussions, but we need something that we could take away and make an immediate impact for our babies, because they don't have time for us just to ponder. They need action. So with that being said, let's go ahead and open it up. Dr. Johnson is here to, you can answer questions, right, Danny? She's here to answer questions. Okay, thank you. Legal disclaimer before she answers any questions: she's not giving you medical advice. She's just
Correct.
sharing.
Thank you.
She's not giving you medical advice. She's just sharing research-based best practices and what the data says. Yep. Go ahead.
Oh yeah, I definitely got one. I wrote down several things as I really love the fact. Thank you for providing us with this data.
You're welcome.
I'm glad that you went through the whole process of what we should be looking for, and as you got closer to exactly what I was dealing with, and helping young students focus on the imagery, the videos, the different aspects that they're being bombarded with on a constant 24-hour basis. And I'm agreeing with Sean with what he had said. We're from a different age group where we know how to turn the television off. Our young people can't. They don't know how to turn the device off. My question is, how can we get parents, because that's another gap that we're also dealing with. We're dealing with a new style parent in the school system to help focus on getting mental health questions answered. Almost like I've been in principalship. You got the social worker who doesn't want to do the work, or you got the organizations who aren't actually looking at the whole child. They just want a data point. How can we get some more information like this transcribed to a millennial style parent so that they can feel more comfortable with helping to get both their household and themselves looked at? Is that something that you work on? Is that something that you do?
It can be difficult because, like the millennial parent, a lot of them, they think they know everything and they don't want to hear constructive criticism. But I think when your child's life could be on the line, you just have to be blunt. And sometimes also letting them know, these are the statistics. This is what could happen to your child. Our kids are dying. I want to help you. I am here to help you. I'm not trying to belittle you. I'm not trying to say you're not a good parent. We're a team. We are here to help your child together. Let me do what I can to help you. And I think maybe approaching it that way can help. Because a lot of parents do think that they're very sensitive to criticism. And I think if you make it very clear that it's not a criticism, you're in it to help their child, that could be a good way to approach it. Hopefully that answered your question.
Yes, but what I actually want, I'm gonna get a little deeper. Okay, so dealing with, I know we got a lot of individuals on here who are principals or even higher up administration. The piece that I'm actually asking to see if possible, the same way Sean designed this program and called for us to get the information, is there another way that you help facilitate the information down? Because I'm pretty sure you got some type of consulting service along the line.
Oh, no.
Because what I'm saying is
the
money doesn't, or a lot of folks on the call can understand, the money right now isn't aligning with actually helping the kids become better and manageable with the trauma that's already occurring. Like what we described, the trauma of the COVID slide. We're already on top of the summer slide. And then on top of now being virtual, where bullying can happen 24/7, things of that nature.
Right.
I think a lot of times as adults, because we know how to turn it off, we think our children know how to turn it off. But they're in the midst of this right now. So my question, I'm gonna go back. How can we build a program to help get in front of the people who, Sean maybe can help me, who are helping to disseminate the dollars to get someone such as Dr. Johnson to come in and talk to superintendents, talk to individuals who affect the social emotional programming across the districts, because this isn't being addressed at all. We're glazing it over as, oh, they have a reading disability. And on top of, I think now since COVID is here, that we have an opportunity to go back and highlight. See, because I say school wasn't right for Black boys prior to COVID. It's only going to get worse now that we're forcing them to do things online. We're forcing them into an arena well, we haven't even addressed the prior trauma. So that's what I'm interested in. Sean,
Right.
maybe
Okay.
if I could put it
No,
in there, how can we connect Johnson to some more school districts? Because this is the real gap that is occurring.
Okay. Yes. So now, yes, I understand the question now. So am I technically a consultant? No. Could I be? Yes. And could I find some other psychiatrists who wanted to be Black psychiatrists? Absolutely.
Yes, that's what we need. Black psychiatrists.
Okay.
There we go.
Yeah.
There we go. So that,
that
might,
how you get the school district to pay for it. Now that's another question. How do you get them to think it's important enough to pay for it? That's where the question lies. How do they make it a priority?
You know what? I want to, so part of, I should have told you this, Justin. So part of this education roundtables that everyone speaks, and we pull from some of the resources. I wonder, being a superintendent CEO, is that something maybe you can provide a little information? How, so Dr. Johnson is the resource. Elam is somebody who wants to bring someone like that to speak. How do you get that on a superintendent's radar?
Well, I think, I don't know. Are you in Michigan? Not you, Sean, but who asked the question?
Steve, Steve is in Michigan.
Okay. So here, and Miss Johnson may, Miss or Mrs. Johnson, I'm sorry, I didn't know.
Dr. Johnson.
Dr. Johnson, I'm sorry.
Yeah.
So in Ohio, we in our school districts, our state government has given us wellness funds. And earlier when I introduced myself, I'm really interested in the topic because we are actually using those wellness funds to open up health clinics because we don't have any pediatricians in our city limits. So all of our scholars who are in Youngstown City Schools, they have to go outside the city limits to see a pediatrician. And most of those scholars don't go. So they don't see anybody at all. So what we're doing with our wellness money is we're using that money not only for their physical health, but also their mental health too. So we're bringing in psychologists and psychiatrists. Actually, our goal is to bring in African-American psychologists to work with our students and psychiatrists to work with our students. And it's just part of what we have to do. And I think that's something, it needs to be brought to your superintendent's attention and for them to really understand, because until I started having a discussion with some of my colleagues, they don't have a clue. And for those of you who don't know, I'm in Youngstown. So there's 13 school districts in my county, and I'm the only African-American school district in my county. So when we start having this conversation about mental health, we know how it is in our community, but it's bad in other communities as well because they don't recognize it. Something that hit home for me. I'm the son of a preacher, so talking about mental health is really taboo because you're not crazy.
Justin, I'm sorry, Justin, can I pause you just briefly?
Yeah.
Hey, everyone, I just want to add a little bit of value to what Justin's saying. Justin is a sitting superintendent, and he's a veteran superintendent. He's been a superintendent approaching a decade. So what he's saying, I really want you to feel the whole power of what he's saying, because these are lived experiences. He is actually giving out information that's actionable, not something that he thinks. These are things that he's done and he knows. So I just want to say that.
Right. So we have to make sure that the religious piece is important, but there's also another mental health piece that we have to make sure we include, because our community and mental health is so taboo. Because, back, and I'm even aging myself. I mean, I'm 46 years old, and when I was younger, it wasn't something that was recognized. Most of the time when something like this happened, Black folk, we gonna beat this out of you. We're gonna beat that demon out of you instead of really addressing it. And that's something that you also alluded to too. When our parents came from the South, they didn't bring those, they didn't tell us, or they didn't share it with us, those stories that happened and that trauma, because they wanted to leave it behind, not realizing by doing that, they're actually creating more trauma for us, because now our kids aren't exposed to it as well. So we're beginning to see that as generational. And I'll say this and I'll shut up. Even last week on I think on Thursday in Zoom, we had a student who was putting a message on her Zoom, and luckily we have gaggle about committing suicide. So we went to that student's house and we then found out she wasn't there. She's learned, she's doing her remote learning from California, but we were able to reach out to her. So those things are important, and it's important for your teachers, our teachers, to be trained on those things as well, so they can recognize them, because a lot of times they get so busy that they don't take the time to really look at those factors in which you spoke of.
Hey, thank you, CEO Jennings. I appreciate that. Speaking of California, I want to transition everyone. I want to hear some of our West Coast folks. We haven't heard any of your voices yet. please chime in. I see we got, we have one sister on here. I saw her join, Tyra Williams. Are you there, Tyra? Okay, that's all right. We come back to that sister. But some of my West Coast folks, let's hear, especially I know oh, Tyra, there you are. How you doing?
Good morning. I'm here. I'm good. How are you doing today?
Doing well. Well, thank you for joining us. We didn't want Sister Johnson to be the only one by herself.
Right, absolutely. Thank you for inviting me to this conversation, this very, very important conversation. In the years that I've worked for Seattle Public Schools.
Actually, can you tell us what you do as well?
Absolutely.
Yep.
So my name is Tyra Williams. I am a manager of family services. I'm the liaison to the state for attendance, and I oversee family support, McKinney-Vento, and foster care. And so I've worked for Seattle Public Schools for over 25 years. And during my time, I've seen a lot of students struggling, impacted by racism, and just having a difficult time navigating the school system. And so that's a part of my passion that I bring to the work, is because I realize and understand that our students and families, if they don't have the support that they need in order to get some type of leverage with our students being educated, that our babies fall between the cracks. And so I'm glad to be a part of this conversation. Not going to take up too much time. I mean, Sean, if you have some other questions that you kind of want to bring to the forefront, I'll be open to answer them. But for now, I just wanted to listen and absorb the data and the information and have some thoughts that I can figure out ways to increase support to our students in Seattle Public Schools, specifically our African American students. Thank you.
Yep, perfect. Thank you so much. Last one, because we're up near the end. I want to honor everyone's time. Brother Shaw, do you have anything, just because of your specific background and the environment you're working in? I just thought that, you have some great things to add as well.
Well, one thing I do know is that one of my teachers was asking me a couple of weeks ago about working with our mental health department and trying to get more mental health providers of color in there, because we predominantly have students of color in there, and a lot of students, it's taboo to talk to somebody about, things that you're going on, because, the one thing that I found with my students is that, they live in with a lot of PTSD, persistent, traumatic, stressful environments. When they leave detention, they go back to those same environments and have to deal with the same stresses that probably got them in the situation they're in the first place. But that's one thing that I need to work on, is trying to get. It's not a school district. It's a King County. It's a whole different agency who bring the mental health providers in there, who have the mental health providers there. So it's kind of like trying to work with them, but not trying to, burn any bridges by saying, well, you ain't, I know you trying to help the kids, but, I don't know how to start that conversation, what I'm saying, with them, without trying to piss them off. You know what I mean?
Yeah. Well, it's difficult because there's just very few Black mental health providers in general. There's just not a lot of us. However, if they have any, I mean, quite honestly, it would not be a bad thing to ask the question, do you have any Black mental health providers? And if so, would they be interested in working in our school? Because we have a need. There's numerous studies that show the outcomes are better. People don't like to believe it, but outcomes are better, particularly with not just mental health, cardiac outcomes, OBGYN outcomes, when your provider is the same color as you. It's just a fact. It just is what it is. But I think particularly when a lot of the stress right now is due to racial unrest that kids are dealing with, and when also COVID related, and COVID is disproportionately affecting us, that a lot of kids are not going to feel like a mental health provider who doesn't look like them understands what they're going through. So I don't think it's unreasonable to at least ask the question. And if they don't, then I don't think it's unreasonable to ask if those providers that they do have are culturally competent or willing to be culturally competent, because they really do need to understand what these kids are going through. Do they even know what the neighborhoods are like that these kids live in? Do they know what their households are like?
No, I doubt it. I mean, the kids tell me stuff, you know what I mean? And I listen to them, and, we have a good relationship, but I'm not a person who can consistently give them counseling and therapy and that kind of thing. You know what I'm saying?
Yeah.
Really help them in that area. But I will definitely I'll softly bring it up in conversation and see how it goes.
Yeah, I mean, I understand it's not an easy conversation, but to help your kids, I don't think it's unreasonable.
It is. So thank you for that. I appreciate it.
You're welcome.
Thank you. And so we're 2 minutes over. So I just want to remind you all, this has been a free service from the Fisher Education Consulting Group. We have our education roundtables every month on the second Saturday. Just a quick reminder, our mission is to collectively brainstorm and develop a comprehensive action plan for providing support to all members of our African diaspora using our chosen field of education and our chosen career as professional educators. Our action steps will be once a month, we'll have a meeting to provide support to our fellow professionals in the education field, and also to brainstorm and create a specific strategy, as we did today, for us to take away and use over the next month and then talk about it when we come back. So with all that being said, I would like to humbly thank my awesome friend, Dr. Danielle Johnson.
You're welcome.
Caller. Yep, I think there's a delay there.
You're welcome. Thanks for having me.
Yeah, absolutely. With that, everyone, we're going to close the formal part of the meeting. If anyone wants to stay around and talk to me, that's fine. I think Dr. Johnson has to move to the next thing. So, yep, thank you, Danny. I appreciate it.
You're very welcome. Have a good day, everyone.
Yep.
Thank you very much. Okay. Appreciate you.
All right. You're very welcome. Bye.
Hey, thanks, Sean. Appreciate it, man.
Yeah, anytime, brothers, anytime.
And is her contact information in there?
Yeah, absolutely.
And how we gonna get the link to the video?
Oh, you know what?
There you go. Food for thought.
Yeah, no. Actually, you know what? It actually sends out once we end the meeting. So everybody that was officially invited, yeah.
Sweet.
Yeah,
I want to go back to it. And do you have the link to that video clip she sent? I mean, the video clip we were watching.
Yeah, absolutely. It's in the invite.
Okay, cool.
Yeah. So I took your feedback from the last meeting, so I went ahead and spent the extra money and upgraded the system. So you'll get all that when we end.
No, man. I tell you this one, man. It was a lot smoother than last month. I felt like the connectivity was better. Everyone being able to, I thought it was all good. So this was real good. So
I appreciate it. Thank you, sir.
If you need a donation, let me know.
No, we good, brother. The donation is make the difference for our people, man. That's what I need. That's my payment right there. You know.
I appreciate it. I know if I have to get a car wash going or something like that.
Yeah. No, time's not that bad just yet, brother.
No, thanks, Sean. Appreciate it.
Yeah, no problem. Anytime. Take care. Hey, Dr. Gary, thank you for coming out, sir.